Hello. And I am here today. I'm Michelle Smiley. Now I see interpretive coaching, and I am with my sister Alice. And we wanted to talk a little bit about what kind of language we use around issues when it comes to mental health and when we ourselves are going through struggle, and potentially finding some more neutralizing terminology that can help express what is happening without creating a judgment around it. So I'm going to hand you over to Alice. She can give you a little bit of background about herself and what she does in this realm, and then we'll get to the discussion around the terminology and language that we use when we have mental health and emotional struggle. So, Alice.
Hello, everybody. So like many humans living your human experience, I've had different layers of strain and difficulty, and at times has triggered depression symptoms. So, and this is a long-standing theme in my life. So whether you've ever had formal mental health symptoms, because they look very different and different to people. And I'm one of many who's ever had anxiety symptoms or depression symptoms. And of course, we're thinking of those as they come up and become active. That doesn't necessarily mean that you have disorders. I'm not here to speak to disorders, but just the lived experience of trying to handle really heavy, big experiences, emotional experiences that we feel internally. So the two components, of course, that always come up are the sense of self, right, within our own body, but also the mind component in how our mind wants to interpret. And maybe I think with heavy emotional experiences, often there's a mind spin that's heavily negative, right? It has a really hard time interpreting what's actually happening without some sort of internal narrative. And there's a whole lot to say about how our culture influences that, how our fears as a culture influences that, how our misunderstandings about what our internal experiences are with relation to how we feel ourselves is distorted often in our culture. And it hasn't typically been talked through and honored in the way that each of us need. We all need to understand what it is we're experiencing. We all need to have a sense of validating it without feeling like we are somehow broken.
Absolutely. And I would love just to give anybody who is watching this some background on the work that you do. If you could give a quick synopsis of your background professionally, and then we can move forward from there.
So professionally, I work in people services and in a support realm. So I've had a long experience of working to support as a first wave of support. We would call it coping and support counseling, if you want to assume that counseling is one-to-one counsel, not formal clinical. But I've worked in a long way with lots of different people at lots of different ages. So currently I'm working with high school population, but I have worked with adult population and have also been the receiver of different types of support services as well. And so from that place of personal experience and the needs that come up from a personal validating human place, and how I can integrate that as a person, even receiving, some information that's really private from someone, even if it's a one-time conversation, and trying to help people delineate what their next step of coping might be or empowerment might be. So in a general realm, that's the type of work I've been doing for a long while.
Thank you so much. So you have a rich background in this. And the reason why we had talked about creating a quick little video blog around this topic is I've experienced times where I've been in deep, deep struggle emotionally. My mind spins out of control. My nervous system goes haywire. It's as if something outside of me and inside of me is taking control of everything, and I don't have much power. And then to make matters worse, some of my biggest fears, some of the contributing factors to that are, oh my God, I can't say anything because somebody's going to think I'm crazy. Or the terms that we use about, I'll be judged, or, oh, come on, just get over it. Or it's not that big a deal because for whoever's on the outside hearing whatever you're saying, they're not able to empathize in the same way or understand because they haven't experienced it in the same way. So somehow, my experience at least has been that culturally speaking, in general, when it comes to any kind of mental, emotional help work, whether that's life coaching, whether that's formal clinical therapy, whether that's whatever, breathing, meditation, whatever it is that you do to help calm and center yourself, often has this side component of a lot of judging from the outside and then judging from the inside, and using terms that are harmful, not helpful. This is stupid. Why can't I just get over it? Oh my God, you're so over the top, or I feel crazy, or this is ridiculous, or just dismissing and diminishing the experience and not having language to kind of just give it a neutral stance from which it can feel, this is real. It doesn't have to control me. And now I can step into a place where I have some words that I can use that can help me recognize the factuality of what's happening and maybe bring me back to a little more grounded place within myself as I'm experiencing what I'm experiencing, which can often be very scary and very feeling out of control.
Yes. Yes. And so with that in mind, to your point, the cultural piece of the phrase I used was brokenness, which also kind of assumes that there's a woundedness part and how that's interpreted in our culture, like keeping things in, not sharing to the degree that would really validate it. So from that place, we must, in my obviously, in most of our opinions, we need to feel like we're able to validate it for ourselves. So getting support outside of ourselves is absolute, right? Feeling like you have those trusted parties that you can share these very intimate experiences with, or those service providers, be it formal or more informal, practices that allow for you to reconnect from your mind to your body. And whether those are services or practices you're involved in, there's all of these facets to this, but feeling more okay is the place that we're all looking to get to. And how you get to that is really yours to kind of follow through with some urges. But for the interest of what we've been talking about is how do we neutralize our experience a bit, because it's so big and can be so painful at times in those moments. One is not jumping into diminishing, right? That we actually do, in fact, honor it without attempting to piggyback on diminishing experiences already. So examples are, right, even using language that doesn't pathologize there. That's so although you may be diagnosed with any number of things, and that's maybe valid from a medical standpoint, but if we're talking about some emotional pain, let's say, perhaps what I have found to be helpful is calling it pain. That pain shows up in lots of ways, and pain, rather than this is this brokenness in me, this is a theme of pain that I have. Typically, we will find that we have themes. There are themes of pain that come up, whether it be fear or worthiness or not feeling enoughness, and how that radiates out, right? So when we start to see some of those themes, that come up in particular, just honoring the fact that I'm feeling pain right now, and I have a theme of pain I'm trying to sort out. That may help to honor the fact that you're in something valid, and yet it's not only this one way of defining it. In fact, it's often not defined by one thing or one diagnosis, if it's a diagnosable thing or something you're carrying. So then, to feeling more okay,
there was a second term, so I'm just gonna jump in here. When I was in particular having a really significant episode of my own and feeling like I was going down a rabbit hole and couldn't come out of it. Like I just could not pull myself, or felt like I could not pull myself out of it. And every time I think about it, it would get worse, because then I would think about all the implications that it had outside of me, culturally, with people who might know me or not know me well enough to recognize that what I was experiencing was not craziness. But I would use words like that. Oh my God, I feel like I'm going crazy. Oh my God, like all of this. And you gave me two words that were extremely helpful for me personally to validate and neutralize some of the self-criticism that comes along with when we experience extreme emotional pain. So I, for one, do one of two things. And often I shut down and go numb. So I don't feel anything, which in and of itself can feel like a nothingness, which can make you get a sense of things are okay when they aren't really, or the opposite, which is this really extreme feeling like you're out of control, not necessarily from the outside looking like that, but feeling that way. And you used two words. One was experiencing pain, and these are symptoms. So for myself, even if I notice that something should be triggering me to feel more emotion, but I'm not feeling much of anything, using the words, oh, this is how my body may be referencing pain, or a symptom of some emotional thing that I'm not able to at this point in time address, or I'm not addressing. And the same goes for the extreme on the other end, where it's such emotional heaviness that almost there's a propensity to like cry spontaneously out of a pain that you can't even identify. Being able to say, I'm experiencing pain, and this is one of the symptoms, that
yes,
validates it as real, the way we would validate a physical hurt or harm that exists.
right, because it is real pain. We've just not been taught to honor it or see it or identify it that way. We culturally, we have been led to put them in categories. That one type of pain is more natural, normal. The other type of pain is something to be judged. There's a woundedness, brokenness, right, sense about it. Shouldn't happen. So yes, that requires a bit of being and recognizing that that is true. So the belief that this is something you deserve to help yourself recognize, even giving up the cultural, right, the cultural learning part, and moving toward, I'm going to honor this for what it is pain and symptoms. And again, we all, when we pay a bit more attention, would clearly recognize themes. And themes are you noticing a pattern, which is symptoms, right? So that's meant to re-empower you, because it allows for us to have a better understanding. Like, this is coming something. It's not because I'm inherently broken. And I have these themes or symptoms that tend to come up in these scenarios that maybe are associated with other scenarios that were also painful, or we felt disempowered, or we had any number of things occur, whether that's current or in our past history. And that's a whole different realm of people looking into their own private needs and selves. But in the now moment, honoring
So
Now
just to
that,
wrap this up, because I wanted this to be something that was digestible, a length of time that somebody could look at and digest it fairly quickly. Some terms that can help when you are having those emotional moments, and potentially, or longer than moments, and potentially are getting into a place of judging yourself, or fear of judgment, or self-criticism, or a sense of I'm broken, something's wrong with me, that some terms that may be able to assist in bringing back to a centeredness and an understanding and a validation of what's happening would be, this is pain, I'm experiencing pain, and these are symptoms of that pain.
absolutely. And of course, in that, because we're feeling so vulnerable, there are things we can do in simple ways to help us feel more able to be with that, right? Because there's an overwhelm too. So did you want to step into that part, some of those simple things?
Absolutely. Let's look at some of those simple techniques, tips that somebody might be able to do in the moment, or to help get them through whatever it is, or help process some of that. And of course, in all of this, if you are having symptoms that you feel need more professional assistance, absolutely contact people, contact someone, sit down with a clinician, sit down with a licensed therapist to get to really the nitty-gritty of what may or may not be occurring for you. So
yeah, some of the things that I found to be really supportive, self-supportive in those moments, in kind of caring and honoring myself in those moments. It may not feel like honoring. It's more like responding, right? But responding is necessary, right?
And
so it's not just.
And responding is different than reacting. Responding
Yes.
means I've taken time and I'm being intentional in some way.
Yes. So there's an intentionality, excuse me, to respond, as opposed to just the spin out that tends to happen right when we feel overwhelmed. We may have identified this as symptoms. I'm in pain, but it's still, our mind still, our body's still really activated, our mind's kind of taking over. So the whole part to re-empowering ourselves to bring in a response of, really, it's deep self-care, is to give yourself a moment to pause, and maybe more than a few moments, some minutes to pause. So the assumption is that when you're in a sense of overwhelm, you're likely feeling a whole lot in your body. And because that's where our body and nervous system begins, before those messages kind of go back and forth between your body and your mind. So there's such an important piece to reconnecting to the body, right? We're getting out of our head and reconnecting to our body. People may already be doing all kinds of mind-body practice to be very understanding how empowering and connected that is. So they may lean on some of those things already. But in a very basic way, if you're not, to get out of your head a bit and reconnect to your body. What that really means is that you take, in an intentional way, a pause, so a private pause, however, whatever you have to do. If you're driving, if you can pull over, if you're in a space, if you can find a private corner, however that looks to you, and that you're able to take your attention inward and really stop what you're doing, pause, and take your attention inward. And so inward would be focusing on how your body feels on the surface that you're on. So if you're standing, you're taking your attention to the base of your feet and really focusing on the attention of your body in support under your feet, your body against the chair. And you're really intentionally taking that focus inward. And you're bringing that in. At the same time, you may also be needing to take attention outward. So there's this two-part thing, right? We do this internal focus where we're taking attention to the surface that our body is supported on our feet, the base of our body, right? Our core, our butt against a chair. And then also softly seeing what's in our environment. So the first part may sound a lot like grounding. People are familiar with grounding. The second part is really called orienting to your environment. What that does is it allows you to be in the moment, here and now. And that's a big part of allowing your nervous system to recover. So as long as you can take those moments as a beginning step to stop, pause, feel the surface of the floor under your feet, the surface of the chair or whatever you're sitting on against your body, and softly noticing your environment. So that might be just looking out a window and noticing the sky, the tree, the house, the street. Perhaps it's inside your environment. So you may notice the wall, a picture on the wall, a book, a shelf. Just gently, slowly noticing what's around you. You could be looking at your own hands, your legs, your feet. So the idea is allowing both your sensing outward and your sensing inward, and you just attempt to pay attention to that. So those are first two steps that might be helpful. The other is we always tend to know self-soothing. Everybody's got a self-soothing strategy that they've leaned on, those quick ones. So often that might include moving your body. Moving your body gets you connected to your body, right? So perhaps after you've paused and you've took a look around your environment, maybe you need to take a quick walk around your room space. By quick, I don't mean fast. I just mean like a short. Moving your body. Walking outside is a beautiful way to really engage all of your senses and get out of your head and reconnect to your mind and body. And at the same time, you could be paying attention to how your feet feel as you're walking, how your body in space feels as it's walking, while noticing the temperature on your skin, the sight of the light, anything else outside, if you're able to do that. And of course, many people pay attention to their breath. And just allowing your breath to slow if that feels comfortable to you. You don't have to do anything in particular at that point, but if you're well versed in some other techniques that bring calm to you, that's where being intentional about that as a next step.
And thank you so much. What I'm hearing is a lot of paying attention to your own senses when you're going outward, even inward, like feeling, sight, potentially what you're hearing, what you're smelling, to bring you back to the moment and yourself in space outside of the emotion that's capturing all of your attention.
Yes, and those allow your nervous system to kind of come back to a different focus.
So what we've talked about are some language switches or language additions when you're really in overwhelm, extreme emotional, either real numbness or real extreme emotional overwhelm, to identify the fact that this is pain and this is a symptom of pain, emotional pain, and that there's no judging in that. Those terms are just pain and symptom. And then some actual practices to get your mind and body for that moment back into some sense of semblance for yourself. So actually pausing for a moment, feeling the parts of your body where they touch other parts. So feet on the floor, your back against a chair, and really noticing that, and then noticing what's happening around you or what is around you through some sort of sense, whether that is just slowly scanning to identify that's a wall, that's a picture frame, that's a window. Doing a little movement, not necessarily fast, but short in duration potentially, and then getting outside and doing something in nature, even for a very short amount of time can all bring you back into your body and help re-regulate your nervous system.
Yep.
So you
That's what you're just
handle what's
allowing.
happening.
You're allowing it to go into its regulation. You're allowing, right? Because our bodies are built for this.
Oh, thank you, Alice. Was there any last thoughts that you wanted to share?
It's so very important that we know that we can bring this and are the ones to bring this to ourselves. We are the only ones sensing ourselves in any number of moments. So, and that's a different way of sometimes interpreting what our own power is, what our own coping power and empowerment really is. We are really the only ones who can sense it moment to moment.
Yes.
And that's a great gift.
Yes, it is. Yes, it is. That means that in the end, we have power to do even the slightest thing that is going to make us feel better, and try them on for size.
Mm-hmm.
Thank you, Alice. I so appreciate you.
Thanks, Michelle.
Love you, sister.
Love you, sis. Bye.